now your monitoring screen is gonna come up, okay? The top box here, and it says what they are. This is the ECG box, okay? This box here is CO2. This box is the SpO2. And this box is the NIBP, which stands for non-invasive blood pressure. Because we're not like going in anywhere to get the blood pressure, we're just getting it from the outside. So NIBP, non-invasive blood pressure. All right, so first one I'm going to start with is the pulse ox. Okay, that's the SpO2 pulse ox, same thing. Can everybody see the red light? Okay, so where's this red light going to go on the patient? Underneath the tongue, right. Okay, so I'll put it on my finger because it will. Then I'll show you here how it's going to show up on this machine. So the orange is the SpO2 box. So anything orange is going to be SpO2. So it's trying to get a reading. Apparently I'm dead.
Tracy, your flatlining
There
there.
he is.
On your tongue.
Yeah, hell no. God. They use this thing on the animals in surgery. Blah. Putting that on my tongue. And it tells you here searching too long, so. Oh, there we go, I think. Or not. Okay, let's put it on a different finger. I don't really know why that should make a difference, but let's try it. And this is movement. When you see, little things like that, it's just movement. There we go.
She's alive. We didn't have to use the paddles.
My God. So it shows you here how the pulse is beating, okay? This tells you the pulse ox, which it says right over here, SpO2. And then the littler number, that is the heart rate. So the big number is the pulse ox. The little number is the heart rate.
So it's 87 is heart rate.
Right, right. Yeah, so don't panic and think, oh my God, it's, pulse ox is 85, whatever. Nope, it's the big number. So that's how that's gonna work. All right, next thing that I will do, this is the CO2 monitor. And CO2 is in blue. And normally, again, this is gonna, well, maybe I didn't tell you that, but this is gonna hook up, and I didn't bring my trach tube, sorry. It's gonna hook up to the end of the trach tube. So one end will go on the trach tube from the patient, the other end will go to the anesthesia machine. So it's a closed system, which is why we can get it in anesthetized patients. But I'm gonna try right now to just kind of blow into this and block it so you can see the blue wave. All right, so it'll look similar to that because there's a lot of leakage and stuff. But here's the CO2 up here. It says ET CO2, end-tidal CO2. It's 34. Okay? And you'll see the waves as the animal inhales and exhales. So that's a great way, just visually, to tell that your patient's breathing, as long as they're hooked up to this. This over here is supposed to be the breaths per minute, or respiration rate, RR. For some reason, I don't know, maybe I didn't do it enough times. Okay, so now it's calculating that I'm breathing about 24 times a minute. Okay, is that high in an anesthetized patient?
Yes.
Okay, it is. So usually, what did I say, like 8 to 12 or something is average, in that range somewhere. So yeah, 24 obviously is a little high, but that's what it is. So this is a CO2, this is the RR, or respiration rate. Okay, this bottom number, we normally don't ever pay attention to. It's the in CO2, which honestly, I couldn't even really tell you what it stands for. I think I knew at one point, but I don't even remember because we never worry about it. So the top two, I think it has something to do with just residual CO2, which again, we don't worry about. So just the top two you worry about, okay? And look for that blue wave. Any questions on that? All right. Next thing we're gonna do, this is the EKG, okay? ECG, EKG, whatever, same thing. And in human medicine, they use a 12-lead system. In veterinary, we use a 3. So it will tell you just probably about any machine that has an EKG on it. It will give you a color coding system. But learn the colors so you don't have to look at this every time. Because in an emergency, you're not going to want to sit there and try to decipher, okay, now this goes, it's white. So you learn the system. The way it goes is white says RA. So what do you think that is? Okay, right arm or armpit. So that's going to be their right forelimb. And we connect them right, you know that little skin in the armpit area of the animal? We just pull it up and we clip it on there. Okay? So white is right. And then red is left limb. So where do you think this is going to go?
Is it the left one?
Nope. The left leg. So it's going to go to the left limb. It's going to go to the pelvic limb. Okay, because these are the arms technically, and then these are the leg or the limb. So when we put it on the left, it's going to go right above where the stifle would be, the knee joint. Okay, we just pull up a little skin over the knee and clip it on there. It can go up here if needed. It can go down here if needed. It just, normally it's here. But if there's going to be surgery right there, well then you obviously have to find another place, but somewhere on the left area. Okay? Then black is LA or left arm. So where do you think this one's going to go?
That one go in the armpit?
It does, left armpit. All right, so the little saying that you can remember so that you don't have to look at this every time is, and this is what I normally do. So white is right, and then they have smoke over fire, okay, because fire's red, smoke is black. So if that helps, or you can make up your own little thing. I used to do white is right, red is rear, and black was the other one because I couldn't think of what what to say for that. But then somebody was teaching me the smoke over fire one. I'm like, oh, okay, well that probably sounds a little better. So white is right, then you have smoke above fire or over fire. Okay? And the EKG, what does that measure? What two things? Okay, heart rate and rhythm. Now, unfortunately, I am not hooking this thing up to me because it pinches like hell. So I'm not going to hook it up to me to show you how it works, but what I will do is I can maybe get it to do something. Sometimes if the leads touch, it'll do a little something. So you'll see hopefully a nice decent waveform normally, not this garbage. But here's where it's going to give you the heart rate. Okay?
Oh, no.
Yeah, now it's telling you that, the heart rate's bad. It's flashing red. So that means something's going on. You better look at that. But that's what you're going to see, okay, when normally it's on something. Okay? Any questions on that? All right. So you're going to have to hook that up. Then the last one is the blood pressure, the NIBP, which is the purple thing here. Oh, come on. All right, so this machine has particular cuffs that it uses with it. With the Doppler, they use these cuffs, and I'll show you how we do both, okay? They're both measured the same way, however. So you take your cuff, and this is how you figure out if it's appropriate size. If I'm going to use a forelimb, I'm going to take my cuff, lay it lengthwise. I don't care how long it is. What I want to know is the circumference of the leg. It's got to be 30 to 50% of the circumference of this leg. Okay? If I'm gonna do the pelvic limb, I'm gonna take it down there, and I'm gonna hold it lengthwise over the limb, and if it's 30 to 50% around or the circumference, then we're good, okay? The other thing, and you're gonna have to show me how you do that. And remember the 30 to 50, because I'm gonna ask you. All right, the other thing to pay attention to on pretty much all blood pressure cuffs, see, can everybody see what this says here on the inside? What's it say? Okay, this side to patient. Always pay attention to that. So you can put it on this way, you can put it on that way, I don't really care. As long as this side is touching the patient. Now this one's probably a little bit smaller for this dog, but we're gonna use it because the next one in size is like way too big. So I'm just gonna, you may have to squeeze it on here a little bit, but that's how you would put it on. It goes between the carpus and the elbow joint on the forelimb. So carpus and elbow joint. On the pelvic limb, I put mine between, right on the metatarsals, between the paw and the hock, which is technically called the calcaneus. So I put it on the metatarsals, that hard portion, you know what I'm talking about, between the hock and the paw. You'll see a lot of people put it above the hock in that curved area. And I was always trained in emergency not to do that because it's a very flexible area and it may not give you the correct or the accurate blood pressure because it's so squishy right here. On the metatarsals, you're not squishing these. That is just bone. So you should get a more accurate reading, as that's the way I was taught. But if your clinic tells you to put it above the hock, then put it above the hock. But for the purposes of the practical and me, you're going to put it on the metatarsals. Okay? Any questions on that? All right. So I'm going to show you how this works. Normally I can get a reading, like if I wrap it around a couple fingers. So let's try it here. It may not be a correct reading, but it's something. So when you've got this hooked up, you're going to hit the NIBP button, non-invasive blood pressure. Okay? It's going to inflate this cuff and it's going to start to go to count up. Okay? Once it reaches a certain number, which I think might be like 150, it's going to start to drop little by little, and it's looking for pulses. Once it gets a systolic and a diastolic, the numbers will go to 0 and it will show you. One thing too you want to remember is to keep your patients still. They shouldn't be moving their legs all over the place. It's not going to give you a reading at all, or it may be incorrect. So you want your patient to try to stay still. Now if for some reason the numbers started counting back up again, means they're not getting a good reading, so they're going to try it again. Ah, crap, really? So it says NIBP artifact, which means it's having trouble getting one. So let me try this again. Yeah, usually I can get one just to at least show you the numbers. Oh, gotta hit it again. Oh, he's just chilling out over there.
Mm-hmm.
And this is beeping yellow because it's, hey, there's no breaths, okay? And it's telling you there's an alarm going off. But that's okay because we're not using it. And you can hit alarm silence. That usually shuts it off for a little bit, a couple minutes or so. Seriously, come on now. I always get a reading. All right, who wants to be a guinea pig? I'm going to put a bigger one on here.
I will.
Okay. Let's try it. We can just try your forearm, like in between your wrist and your elbow. Let's just see if we can get one here. All right, this side, the patient. Yeah. All right, let's try this again. Good grief. I just want you to see the numbers. Ooh, wow, it's really
Yeah, it went
counting
up
up.
again.
Yeah. Oh my gosh.
What are the other buttons on there? It says, what, print and?
Yeah, we can print an EKG. This one's not, it doesn't have a printer on it, but if you wanted to see, if you had an EKG on a patient and it was giving you weird readings, you could hit the print button and it would print what they are. So, this is alarm silence, and then, what is, oh, this is IBP, invasive blood pressure, and this we would use if we had a catheter in an artery. That's the truest form of blood pressure, and there's some kind of thing you can buy that we don't have, that if you have a catheter inside an actual artery, you plug that catheter into a connector into the machine, and it will tell you arterial, I can't even say it, what the arterial blood pressure is. And that would be invasive. So here's the non-invasive, 129/88, so that's the systolic diastolic, with an MAP of 102. Okay? So do you think that's a decent blood pressure? Yeah. I mean, it's not 120/80, and the diastolic's a little high, but again, we're doing it on her forearm, and it's probably not as accurate as it should be. But, so that's what it's gonna look like. You're gonna see these three numbers. Now, normally, we should get 5 readings. Well, no, I shouldn't say that. We used to do 5. We could get 3 readings, oopsie, and you wanna average them out, okay? Because we've got a 129/88 now. I could do it again, and we might get a 125/82, okay? So normally we get 3 readings, then we average all the systolics together, all the diastolics, and all the MAPs, and that is gonna be our final blood pressure. Okay? Any questions on that? All right, cool. So, here's how the practical's gonna work. This one back on there. There is an order that I want you to hook this up in. I'm gonna call you over one at a time, and the order is basically just what I showed you. The animal's gonna have a trach tube in. So, you're gonna do the pulse ox first. Then you're gonna do the CO2. Then the EKG, and then the blood pressure. Okay? So you've gotta hook them up in that order, and you've got to hook them up correctly. I'm not gonna tell you anything. If you're doing it wrong, you know, just don't. Don't do it wrong, that's all. So, if you forget the EKG lead colors, look at this. Okay, it's right there. And I've had students fail the practical. They couldn't remember the colors, and they never even looked at this. So I don't care if you look at it.
For pulse ox, like,
Yeah.
where would we put it?
We're gonna do the light, we're gonna pretend the tongue is the collar.
Okay.
So we're just gonna put the light under the collar, which I would have told you
Okay.
before, but.
When is
the rectal?
Yeah. Nope, unless I can find, we may have a stuffed animal maybe that has a tongue. This is just mine that I always use, but maybe I'll look for one that actually has a tongue on it, so.
What about the one we used last sequence?
Wasn't that this one?
No.
Or did we use a black and white dog?
We used the black and
Oh,
white.
okay, yeah,
'Cause
maybe.
We put the trach tube in and we had the tongue.
Right now, well, we use that for intubation stuff, but did we use it for the practical too? I thought we used this one. Oh, okay.
No, we used it for the practice.
Oh, okay, maybe, but Miss, what was her name, Holly, is using it right now for restraint stuff, so we'll see if it's available. Yeah,
When is this practical?
I don't know yet,
Oh.
but I'll tell you
Okay.
as soon as I figure it out. All right, so this is the rectal probe, okay? If we're going to use the rectal probe, I am going to unplug the lingual probe and just plug the rectal one in. So now you can see the red light, okay? If we were to use the rectal probe in this patient, Megan, I want you to show me how you would put that in this patient. And you don't have to literally just do it, just show me what position that rectal probe is gonna be in when we put it in,
So this way.
okay? So where's the red light?
The light's facing up
Okay,
towards the,
well, right now it's facing down, right?
well, okay, so it's facing down. I'm thinking
Okay.
if the patient was flipped over.
Okay,
So,
and why are we putting it down? Why is the light down? Well, then how did you know to put it down?
remember, I believe I remember you saying it. I don't remember, it's in my notes.
Well, I never said put it that way. Who can tell me? It's gotta face the spine. So it's in the right position, but you
And
need to know
couldn't-
why
yeah.
you're doing that. So, yes, that's why. If the animal was in this position, how would you put it in? With it facing up, right? Towards the spine, okay? If the animal's sideways, how would you put it in? With the light facing this way, right? Okay, good. Okay, so that's the rectal probe if we needed to use it. All right, so I'll unplug that. And I'm also gonna ask you that during your practical as well. All right, so any questions on the order? Any questions on what each 4 of these things does? Any questions on how to measure the blood pressure cuff? Yeah.
It's kind of like that, like, so when we do the practical, we're putting all the stuff on the actual stuffed animal?
Mhm.
Okay.
So we don't have to like get any like values or anything?
No.
Like,
Okay.
we're just hooking it up?
You're just
Okay.
hooking it up, you bet,
How did we do the CO2 again?
on the trach tube. It's
Okay,
gonna be
which
a
that'll
hooked,
be,
hooked onto the trach tube, because I'll have a trach tube either with this animal or another one. It goes right on the end of the trach tube.
If it's not, if you do it on like a day we're not here, can we do it earlier?
Usually not, because then you'd have kind of a heads up maybe over everybody else. I don't want anybody to tell anybody about the practical, that's why they're always done usually on one day, so. What else? Any other questions on anything? No? Okay, the other thing that I'm gonna show you, this is not necessarily part of the practical, but I want you to, well, this one is. I want you to know what the Doppler does. So this is called the sphygmomanometer, all right? You are going to have to know how to spell this for your practical. So sphygmomanometer, all right? Make sure you know how to spell it. So what this does, this comes in handy when we're using the Doppler. So I'm going to get the cuff out here.
Okay, so how do you spell that?
Look it
Autocorrects on my iPad. Awesome. 'Cause I definitely did that.
Meter.
All right.
Oh, yeah, oh, and then meter.
So if I'm going to use the Doppler on a patient, instead, now the Doppler we would normally use on tinier patients, like cats, small dogs, because it's just a little more accurate. Here's what we would do. You'll see this probe here, right? Okay, and can you tell how one side is concaved and one side is straight? All right, the concaved side goes on the patient. There is a little diamond cut wire that's inside of here that picks up the pulse. This is horribly expensive. So if you were to drop this and it hit the floor of the table and broke, your clinic would be very upset with you because it's really expensive. So we don't want to do that. That's why we have this little rubber thing over it so that it's safe when we're not using it. So here's what we would do. First, I'm going to hook up the blood pressure cuff to our patient. Now again, I'm going to lay it lengthwise. I don't care how long it is. I want to know the area of the circumference it covers. Now again, this one's going to be a little small, but who cares? Okay, this also says this side to patient, right? Okay, so pay attention to
Is
that.
that one 30 to 50%?
Yep,
Okay.
all blood pressure cuffs should be.
Okay.
Okay, so I'm going to put this on my patient. I'll set him up this way so it's more likely to go this way. All right, so it goes between the carpus and the elbow joint, same thing. The next thing that I'm gonna do is I'm gonna take some ultrasound gel as a conductive agent, and I'm gonna put it on the concave section. We're almost out of this stuff. Okay, just a little bit, like a dime size. Okay, it doesn't have to be gorged in it, just a little. And then I'm gonna hold it right on the carpus area. I would have shaved a little square back here, and because it doesn't go through hair. So I would hold it right under their, it's hard for everybody to see, but right under their carpus. Okay, I don't really want to put that on the animal, but I would hold it there, and I'd move it around until I found the pulse. So let me show you on me what you might hear, and this thing can get kind of noisy sometimes. You always want to try to keep that volume all the way down until you're in place, because otherwise the animals tend to jump. So can somebody, or Amanda, can you turn the volume? Okay, so here's my pulse. This is what you'll hear on the animal, okay? So you can turn the volume down and turn it off then. All right, so once I've got the cuff on the animal, I've got this in place, and I hear the pulse. I'm just gonna do this right now. Okay, I'm holding it under the paw. I hear that pulse. I'm gonna grab my sphygmomanometer, and I'm gonna squeeze it until I do not hear that pulse through the speaker anymore. Okay, I've basically cut that vessel off. All right, and this is what the nurse is doing to you guys when you go get your blood pressure. So there's a little button on the back here. What I'm gonna do, as soon as I stop hearing it, I'm gonna stop squeezing, and I'm gonna start to let the lever fall, just slowly. Okay, can everybody see that kind of falling? All right, when I hear the pulse come right back through the speaker, as soon as I hear it, I let go, and that's gonna be the systolic. Okay, so on this one here, I stopped at like 166. So that would be the systolic, because again, the Doppler only gives you a systolic. Okay? Yeah.
Okay, so on the back, you pump it and then,
Well, you pump it down here,
oh, okay.
okay? So you squeeze it here,
Okay,
and then you just depress this just lightly so that it starts to fall. And you want to let it fall slow, because if you do it too fast, well, now you're at the bottom and it didn't really give you enough time. So you want to do it nice and slow, so that as soon as you hear that blood pressure or the pulse come back through the speaker, you immediately let up, and that's your systolic. Okay? Normally we also get 3 of these. We do it 3 times, then we take each systolic and average it out. And that's what it'll be. Okay? So normally the animal's gonna be sitting like this, and I'm gonna have this probe under my hand here, holding it on the carpus. So you can't do this by yourself, as long as the animal's not crazy and running around. So I'm just holding it just like this. Okay? You wanna be careful with your pressure too. If I were to squeeze, let me do this again. If I were to squeeze too hard, and always make sure that volume's down when you turn this thing on. Okay, Amanda, you wanna do the volume again? I cut off my vessel. So don't squeeze too hard. Just a little bit of pressure on it so that it stays down on the skin. And sometimes if it's not coming in real well, slide it. Just move it around a little bit. But the thing is, if you do too fast, see how loud it gets, and the animal will freak out on you. So I always, before I move this, turn the volume down and turn it off. That way they don't hear any of that, because it, gets them nervous. All right? So that's how the Doppler works. So you need to know that it measures the systolic, and you need to know how to spell sphygmomanometer. Starts with an S, I'll tell you that. All right. So, that will be the only portion of this on your practical. But I want you guys, to try it on yourselves, just so you can, get a feel for the pressure and stuff. It's gonna be a little difficult to try to use this, cause I don't think anybody has small enough arms for that. When you are done, okay, always make sure you depress this button back here, so it goes to 0. That lets all the air out of the cuff, and then you just remove it. Okay? Any questions on that? Okay. Cool. So I think that was all I needed to cover for the practical. So I'm gonna give you guys some time to practice putting